Assalamu alaikum. Good evening, everyone. I'm Dr. MAHER ABUMOSAMEH, and I will be presenting a topic as a mini review on the geometric, morphometric, and volumetric analysis of the lumbar vertebra for forensic anthropology as well as for clinical application. The purpose of this review to examine both techniques, which will help for both forensic identification as well as for clinical practitioner. The objective of our topic is to explain what is forensic anthropology and to clarify the differences between geometric, morphometric, and volumetric analysis. The discussion, I will be discussing about the anatomy of the lumbar spine and the methodology that I used in my review, focusing on how sex, population, and age can affect the vertebral characteristic. Then I will be exploring the implication of these analysis for forensic and clinical practice. And then I will be mentioning about the result of some studies and discussion with regards to sexual dimorphism, population specific variability, age related variation, volumetric morphometric approaches, and implication of these in clinical practice. So, what is forensic anthropology? Forensic anthropology deals with the identification of remains of the skeleton, often from forensic cases, such as mass disaster, criminal investigation, or archaeological sites. And it requires very precise methods for determining the traits like sex, age, and population. Anthropologists assist in the identification of these remains, as I mentioned, for age, sex, and ancestry, and as well as to reconstruct the circumstances of death, the reason, and the time of death. So we have different type of morphometric methods. We have the traditional morphometric method and the geometric morphometric method. Morphometric analysis use anatomical landmarks to measure the shape of the bone and size, either, as I mentioned, through traditional or geometric method. In traditional method, the measurement, we do the measurement, or the anthropologists do measurement for the length, width, and the angle of the bones to assess the differences in size and shape. On the other hand, geometric morphometric use 3D landmarks to assess the shape of the structure, providing more details and accurate details analysis of the morphological variation. For example, there's a study by Karaman conducted a CT-based 3D morphometric analysis of the L1 vertebra in the Turkish population, and it revealed that the male have more variation than females. This morphometric method, both methods will help to estimate age, sex, and ancestry, and is well critical in forensic identification and analysis. Volumetric analysis, on the other hand, measures the volume, density, as well as mass of the bones. It helps in identifying the size, but it is widely used for surgical planning. For example, a study by Limpton Quill in 2010, they demonstrate the use of volumetric analysis to enhance procedures like vertebral augmentation. Lumbar spine anatomy. The anatomy of the lumbar spine, as we all know, the lumbar spine consists of five vertebrae from L1 to L5, and their main function is to support the body weight because of their large vertebra body and to allow movement. it is important to study the lumbar spine, both geometric, morphometric, and as well as for volumetric analysis for the clinical importance, because many degenerative diseases changes happen in the lumbar spine, and it requires surgical intervention such as disc replacement. So to identify the different size and shape according to gender, sex, age, and population, it will help the clinical practitioner to know for each population or certain sex or age what type of surgical intervention or what method they can adjust for disc replacement, for example. Methodology. I conducted a thorough literature research using PubMed and Google Scholar, covering the articles between 2010 and 2024. And I use three selected process consists of three stages: title screening, abstract analysis, and full text review. Most of the studies employed landmark-based geometric morphometric, which involve taking precise measurement of the anatomical landmark to examine sexual dimorphism, population differences, and age-related changes. Volumetric studies that I selected, on the other hand, use CT-based stereological assessment to analyze vertebral body volumes and intervertebral disc spaces. For example, Karkabir performed a study of the lumbar vertebral volumes to compare levels across the cadavers. So, population, uh, sexual dimorphism in lumbar vertebra, we compare male and female vertebra. Studies found that males have larger vertebra across population with variation in L1 vertebral size, and this is important for forensic cases as well as for spinal surgeries, like to implant, to design the proper size implants for different age group and for different sexes. A study by Slonitsky in 2017 found a significant differences in the vertebral curvature and size between Mediterranean and South African population. Also, there is another study by Alam where they compare the vertebral dimension between Pakistani and Indian population, and they were different than those Western population. This is important info for surgeries if it is targeting certain population and certain ethnicities. Age-related changes. Morphometric studies show that the vertebral size will shrink with age, affecting both height and width. On the other hand, volumetric analysis confirmed that the bone density will decrease in older population, which will increase the risk of fracture. And this is important and critical to adjust the technique, surgical techniques and procedure like vertebral augmentation. So in summary of morphometric studies, sexual dimorphism in two studies by Bozdak, Karaman, and Grivas, they found larger vertebral dimension in male across Turkish and Greek population. With related to age-related changes, one study by Azu highlighted age-related reduction in the vertebral size, which will affect the implant size and surgical planning. With relation to population, two studies by Alam and Singer noted significant differences in the vertebral dimension between population, between South Asian and Western group. And these differences is critical for forensic as well for spinal surgeries, like pedicle screw placement. For volumetric study, the summary of the studies that focus on sexual dimorphism, like Karkabir and Goshman, they identify six base differences in the body volume of the lumbar vertebra, especially L1 vertebra. With regards to age-related changes, volumetric two studies by Azo and Kanawati showed that the vertebral volumes decrease with age, which will impact surgical outcome. Limpton Quill observed that the vertebral volume varies across population, which will influence the spinal surgeries and implant design. This is one of the core important charts that I want to explain in this uh, uh, presentation. It shows that the reliability score of volumetric and morphometric analysis across three main categories: sexual dimorphism, population, variability, and age-related changes. As you can see in the three chart, in the three bars in this chart, the reliability score is higher in morphometric and using morphometric study. Using morphometric analysis, the reliability score is higher than the volumetric analysis. So morphometric analysis show score above 80% with regards to sexual dimorphism, and it is likely because the shape-based metrics capture very minute anatomical variation, which is better for sex estimation. With regards population variability, morphometric analysis also again score higher than volumetric analysis. And this could indicate that the population-specific shape differences are more effectively captured with the morphometric methods, which focus on spatial landmarks rather than the volume size. With regards to age-related changes, morphometric analysis still slightly leading with compared to volumetric, and it suggests that morphometric methods are more sensitive to changes in bone structure associated with age, although volumetric analysis also perform relatively well in this part, in this category, age-related changes. SWOT analysis. SWOT is referring to the strengths, weaknesses, opportunities, and threats. With regards to strength, morphometric excel in identifying subtle shape variation crucial for forensic identification, as well as volumetric offers accurate measurement of bone density and volume, which is essential for surgical planning. Weaknesses. Morphometric requires high precision and may not capture bone density, limiting its use in clinical application, while volumetric may overlook these small shape differences important for forensic identification. Sorry. Opportunities. Combining both approaches can enhance forensic accuracy and clinical outcomes, and advances in 3D imaging and AI-based analysis may further improve both techniques. The threats, rapid advancement in technology could outdate current methodologies and approaches. Variability in research method can lead to inconsistent results across population. So, to summarize, volumetric find the studies that analyze bone shape, size, bone density using volumetric analysis is important for clinical application. Forensic identification is better assessed using morphometric analysis. So for future direction in morphometric research, to expand in the research across many population, diverse population, to have a better insight of the morphometric changes. Integrate machine learning, which will enhance the accuracy of the morphometric analysis. Examine the age-related changes in vertebra for better learning clinical outcomes, and, and also to focus to do more studies on volumetric using volumetric methods for improved surgical planning. Develop morphometric database, which is important to create databases for accurate sex estimation, analyze genetic variation, and enhance surgical techniques. So this is the summary of both morphometric analysis as well as volumetric analysis. So in summary, both are important in forensic identification as well as for clinical application, but morphometric analysis detect subtle differences in shape and size, structure, which is important for the three factors. While volumetric is important for clinical application and surgical planning, like diagnosing osteoporosis. Thank you. These are my references. Thank you.